It's up to you. All right. Good afternoon. Thank you all for joining us. I'm Carmel Angelo, Mendocino County CEO, and welcome to our press conference of March 17th, 2020. I would like to say that Mendocino County services are available. Our offices are open right now. And what we're looking at over the next week is what our services are that are essential and non-essential. This is not a new exercise for us. We've been doing this since 2017 as far as identifying essential versus non-essential services. Our direction from our Board of Supervisors always is the health and safety of the public first. And with that direction, we today continue to keep our offices open to serve the public. Over the next few days, it will be determined which offices stay open to the public, which might close, which offices will stay open with staff, which may not. Again, we have some offices that have small staff, and therefore they may be challenged to stay open over the next few weeks. Additionally, on Friday, this Friday, March 20th at 9 a.m., our Board of Supervisors will hold a special board meeting, and that will be here in the board chamber. Actually, some of us will be here in the board chamber. That meeting will be a virtual Board of Supervisors meeting. The purpose of that meeting will be to discuss, inform, brief the Board of Supervisors and also the public around the county and COVID-19. We have been briefing the board via phone for the past few days, but at the direction of Chair Hasjack, we will be having a special board meeting. Again, that's this Friday, March 20th at 9 a.m. Additionally, Dr. Doohan will be coming to the podium here in just a minute to give you an update on COVID-19 and also to discuss her latest press release. Before I introduce the subject matter experts that are here with us and the physicians, I would like to introduce Sheriff Matt Kendall, who is in the room with us in case there are any questions with Sheriff Kendall. The Sheriff, Public Safety, Public Health, the Executive Office, we've all been working closely together in order to serve the public during this time. So at this point, I would like to introduce who is with us today. We have Dr. Theron Chan, a family practice physician. We have Dr. Donald Kersey, retired local physician. Dr. James Flaherty, local physician, Flaherty, with who has emergency response experience with Indian Health Services and has actually been here through the morning assisting Dr. Doohan. We also have Dr. Suzanne Hiramatsu, who is an emergency room physician and is the Ukiah Director for Pacific Redwood Medical Group. Additionally, we have Dr. Drew Colfax, one of our local emergency room physicians as well. And we have Dr. Parker, who is the Chief Medical Officer with Adventist Health in Ukiah and Willits. Along with that, it's my pleasure to introduce Dr. George Varazzi, who is our WIC director here with the county, and he is also acting as our Spanish translator. So at this time, I would like to introduce Dr. Mimi Doohan, who is our local health officer, our county health officer, who will give you a briefing. Thank you.
Thank you, members of the press, community. I want to make a one slight correction to what Carmel Angelo said, that Dr. Hiramatsu is the director of the Adventist Health Ukiah Valley Emergency Department. Normally, I would like to thank my colleagues standing behind me for coming today. Normally, I would have them standing close with me, but we are practicing what we preach here. We're practicing social distancing. The room is actually set up with people 6 feet apart. We had our temperatures taken when we came into the room. We've all been washing our hands and being very careful to make sure our community and we ourselves stay safe. Because now, as we're entering into a phase of social distancing in our community to try and mitigate this pandemic of COVID-19 and its impact on our community, I feel that it's more important than ever. It's always very important to have press conferences, but it's more important than ever because people may not be able to get the information they want. And in our rural communities and that they need, many people rely on internet communications for their communication, their information. So I'm going to be giving an introduction here that is longer than I might normally give because some people may be relying on this press conference for situational awareness regarding this pandemic. So for those of you who have not met me before, I'm Dr. Noemi Mimi Duhan. I am a family physician. I'm board certified. I got my MD at Stanford University. I have a PhD in molecular biology from UC Santa Barbara, and I'm in my final semester of my Master's in Public Health, Master's of Public Health training from the University of Massachusetts Amherst, which I'm doing online. Many of us are doing online learning these days. But I say this in order to frame the fact that I am educated to be in the position that I'm in now as the health officer during a public health emergency. And as a family physician, I've practiced as a hospitalist and as a primary care physician in the Adventist health system for the last 5 years. So I'm very familiar with the healthcare system in our county, and I'm very familiar with the limitations and strengths of that health system, and that absolutely is informing the decisions that I make as your health officer. So for the public health department and the public health officer has the role of responding to disasters and emergencies, to communicable diseases, and to keeping the community informed, and all in the goal of keeping us healthy. So in a public health disaster, the health officer's role is central. Often, I can say as a physician who is new to being a health officer, I will share with you this role has been new to me since the summer. I've been on the front lines as a hospitalist and as a primary care doctor, and I didn't fully understand the power of the public health officer until I've been in this role. Because the work of the public health officer is often invisible to the community because we're working behind the scenes. And I'm so fortunate to be a member of the Association of Bay Area Health Officers, which is a group that has been advising me and the other health officers in our rural region about how to do our jobs well in this time of pandemic. So I will share in a moment how the Association of Bay Area Health Officers led me to the decisions that I made yesterday, which included an order about gatherings over greater than 50, which is now prohibited, and a recommendation or directive regarding sheltering in place. And that's going to be the main focus of this press conference. But to speak a minute about public health, that often invisible force that is protecting us every single day, and our health department, our public health department, which is behind the public health officer to carry forth those actions. And there's a story that many of you have probably heard where a person is standing by a river and they keep seeing babies floating by them that are drowning. And you think, what's happening with all these babies that are passing by me drowning? And you start jumping in to try and save the babies. And another approach would be to go upstream and see why they're falling in the first place. That is one way to describe the role of public health, that we're trying to go upstream. We're trying to get ahead of the wave of this pandemic that is going to hit us, and therefore spread it out so that it hits more softly and we can slow down the impact. That's mitigation. And we have been working hard day and night. I have been working hard day and night since early January to work to contain and mitigate the spread of COVID-19 in our community so that we can save lives, so that we can save our healthcare system's ability to respond to all of our community, and so that we can have time, perhaps, hopefully, to develop a vaccine and a treatment. In Wuhan, China, this pandemic, well, it wasn't a pandemic when it broke out in late December. It was an outbreak of a pneumonia-like illness that had never been seen before. We've had two other we've had two other outbreaks of coronavirus, MERS and SARS. Like this one, COVID-19, we think they came from bats, and then had an intermediate animal before coming to humans. But because it's a brand new virus to our population, it spreads like wildfire. So the approaches that we take to prevent the pandemic from hitting us in tragic ways are to contain it, and that containment has to do with knowing who has the disease, getting those people into isolation, and then tracking down those people who've been exposed to that person who may not have symptoms yet, and getting them into quarantine. That's the initial, very powerful work of public health, and that's been happening all around the world. But this virus is breaking through those containment efforts. And so now we're into the area of mitigation. And with mitigation, we do things like close schools, order sheltering in place, ban mass gatherings. That's what we're seeing now. And what I've learned from my great colleagues that are the Association of Bay Area Health Officers, some of the greatest minds in public health, one of whom's the brother of one of our doctors standing here. What we've learned from them in the Bay Area is that if they had had more time, if they had more time to understand this brand new disease, they would have done things differently. They were basing their decisions on what we know from prior pandemic planning and response to H1N1, and they were basing what they were doing based on the data that came out of China, which was very powerful data. A study that you can find on the WHO website, which I've spoken to you about when I've stood here before you in the past, a study of 50,000 cases in China of COVID-19 and how those cases presented. Well, in my conversation with the Association of Bay Area Health Officers yesterday at 4 o'clock, I learned some things from them which were alarming. And that is that the China study didn't give us all of the information that we would like to have about COVID-19. We're finding things about it, for example, that we call fomites. A fomite, F-O-M-I-T-E, is something you touch. And I would describe it as a sticky virus. It passes between touch surfaces more readily than we thought. There are other aspects to COVID-19 that the Bay Area health officers shared, that the doubling time is 6 days in the transmission. So therefore, we get this exponential rise in the number of cases. They feel that the number of cases that they saw in the Bay Area was the tip of the iceberg, and underneath each one case was many more that they couldn't see. And in this conversation, they described how this led them over the weekend to get together, the big 6 counties, to get together and together make a unified message across the entire Bay Area of the 6 big counties, the big 6 counties, to simultaneously order shelter in place. When we learned about it yesterday morning, it was a big shock. I meet with the Bay Area health officers twice a week in conference calls. We're in a Slack, which is a phone app channel daily, multiple times a day. But the big 6 had to keep it secret until the announcement. It was a big shock because this is such a rapidly evolving situation that I've said this to you before, to the journalists, I stand here right now telling you one thing, and we might walk out the door and I'm going to say something else. And that's not because I'm not telling you what I know to be true in the moment. It's because it's rapidly evolving and it's actually accelerating. So they decided, because of what they're seeing on the ground in the Bay Area, on, I believe it was Sunday, to make the announcement yesterday as a coalition, as a region, to order the shelter-in-place order. So we learned that yesterday at 11. It actually got leaked. It was officially going to be a press conference later. And so we were here late into the night, as we are every night with our Emergency Operations Center. And we made some decisions, which I'm going to share with you in a moment. I just want to share with you, because I do recognize that some people who are going to be listening to this conference this may be where they get there, because they may have limited internet access now that we're now that we are tending in this direction of sheltering in place. I want to share some information with you about COVID-19. Daily, this changes. The global update is there are 167, it's going to be, I'm going to round these numbers, okay? 167,000 confirmed cases of COVID-19 on the planet, and that's 14,000 new cases in the last day. There have been over 6,000 deaths, and that's about 800 new deaths in the last day. China has 81,000 of the confirmed cases, and here's a piece of good news. Only 29 new cases in China in the last day. About 3,000 deaths in China, only 14 new deaths in the last day. So what this is telling us about China is it's beginning to burn itself out because now people have immunity to this new virus, we presume, and they're coming to the resolution phase of this pandemic in China. But outside of China, we now have more cases confirmed outside of China than in. So outside of China, 86,000 confirmed cases, with 13,000 in the last day. And 3,388 deaths total outside of China, with 848 deaths in the last day. We have 150 countries or territories now in the world in experiencing this pandemic. And the majority of these countries are reporting local transmission. So initially, we saw we could track every single case that we knew of back to Wuhan, China. Then it was back to Hubei province. Then it was back to somebody who might have contacted one of those persons directly. But now we're starting to see community transmission where we don't know where that person was exposed. We have no idea. So this is this community transmission phase. And when that happens, that's when we get into a pandemic. And that's when it becomes very concerning. Very concerning. So also to just share the history, the first case that we had reported in the United States was on January 21st. The first case of suspected community transmission was February 26th, about a month later. That case on January 21st was a returning traveler from China. And the first death was February 29th. So when you look at a map of the West Coast, you'll see hotspots that are in Washington State, and you'll see them in California. And I want to share with you personally that my son, who's 27, is a musician and student in Seattle. My daughter and husband are in San Diego, there's the other hotspot. And I'm sheltering in place with you here. I'm here with you for the duration of this pandemic. And I am feeling very deeply the effects on my own family and what it means to be separated from them, and the concern that every single person here in this room, I'm sure, feels. So in terms of our California update, I just want to give some broad strokes on that. We've had 6 deaths in California as of today. And if you look at the map, you'll see 2 hotspots. As I said, the Bay Area is a hotspot, and San Diego, where my daughter and husband are, is another hotspot. So the Association of Bay Area Health Officers are guiding me in my decisions. I follow what they do closely. I listen to their sage advice. They advise me for our region. I'm also advised by the California Department of Public Health and the CDC. I am guided by science, and I am guided by facts. I have been pressured politically to make certain decisions. I listen to that political will, and I take it into consideration, but my decisions are based on science and fact. And I'll share with you one example of, how there was a lot of pressure on me and the superintendents of schools for me to order the closing of schools. And I will share with you that I did not order the closing of schools. What I did was I supported the superintendents of the schools to make the decisions that they did for something called modified schooling. And this allows the flexibility for the essential function that schools represent to continue. And that essential function for children includes a safe place to be. For some children, it includes food. So we will continue to work with the schools to develop what modified schooling means. And the superintendents are aware that given our situation, it may be hard to reopen to normal schooling, the public schools, the schools in our county, but we are here to support the superintendents in the decisions that they make. And it was really an honor to meet with them regularly this last week and to craft together a unified statement between myself and MCOE. So now I want to speak about the local regional update for COVID-19. As you know, there is a shortage on many different levels of our capacity to test for this disease. And this is so difficult for us because our containment strategies depend on testing. If we can't test and know who has the disease, our containment strategies are crippled. But we're doing the best that we can. And in that regard, I've been asking my team to make a score sheet every day. And the score sheet shows the number of positive cases. And I've told you all that I will share with you as immediately as possible, which would be within hours, if not minutes. So it just depends on what time of day. I would share with you the number of the moment that we get our first case. We have not had our first case. Our first case is, we still have 0 cases in Mendocino County. We have done, in our county, as far as I'm informed, so with commercial testing at this time, I'm not necessarily informed of every test, but I reach out to my healthcare partners and say, please tell me, because we want to keep track of how many tests are being done and how many negative results we get. I will automatically be reported a positive. So we have had 52 tests done in our county that I know of, 3 of those by the public health lab, and 49 of them by commercial lab. So there's 2 routes now. I remember when I first started meeting with you all, I said there is no commercial testing. Well, we only have public health testing, but now we do have commercial testing. So that's 49 commercial lab tests and 3 public health lab tests. Of the public health lab tests, there's all 3 of the ones that we've done so far, we've done in partnership with our hospital, Adventist Health Ukiah Valley. Of those, 2 are pending, and I've been told we'll have that result at 4 o'clock today. Of the commercial testing, the 49 commercial tests, 19 of those were negative, and 30 are still pending. So 52 total tests, 32 are pending. That's part of the problem. We need to have the results more quickly, and we're doing everything we can to partner in that. I also want to share that what we also do in the health department, as well as helping our partners facilitate the testing, is that we help with the quarantining of people returning from high-risk exposures. So people returning at this time, the high-risk exposures would be China, all of Europe, Iran, certain countries that are on the level 3 travel advisory list for the United States. So when we are aware of these people coming back, we tell them they must be quarantined. These are asymptomatic people, and we check on them daily, ask them if they've developed symptoms, and ask them how they're feeling. We bring them food if they need it, so that we can support them to stay at home. And we have had a very active program to actively monitor quarantine people, and we've not had a single one of those people develop symptoms. So none of them have required testing. If they did require testing, we would then take that to the next level. So talking about our region, we have 0 cases of COVID-19 that we're aware of. Lake County, 0 cases. Sonoma County, 6 cases with proven community transmission. It's now public information that the community transmission was with a healthcare worker, and they're now working to contain that. And because of this, Sonoma County, this is breaking news, has ordered shelter in place. So now Sonoma has added to the Bay Area Big 6 in sheltering in place. Napa, 6 cases. Marin also ordered sheltering in place, 11 cases. Solano County, 9. San Francisco, 40. Alameda, 18 cases. Contra Costa, 34 cases. San Mateo, 41 cases. Santa Clara, 138 cases. And we can share these numbers with you, to our journalist partners, if you would like to see this data written down. So Santa Clara is the heart of this epicenter of this outbreak. And think about what's in Santa Clara. A lot of resources, a lot of hospitals, a lot of brilliant people. And there in Santa Clara, they're saying we have to shelter in place to stop the spread of this disease. Otherwise, our healthcare system will not be able to respond. And this is why we are so seriously taking the decisions of the Bay Area. Some people might say, well, it's far away, we're in a rural community, we can spread out. It is my belief, based in science and the information that I have, that COVID-19 will arrive. It may already have arrived. I do speak regularly to our healthcare partners and to both in the hospital and in the clinics and in our skilled nursing facilities. We're not seeing a cluster of pneumonia-like illnesses that are unexplained as it presented in Wuhan, China, that gives us the indication that it's really hit our hospitals and clinics yet, but I think it's a matter of days, and we're waiting for these results. We also have the cruise ships, which I'm not going to go into, but that has definitely complicated the situation. So based on all of that I'm sharing with you today, all of it, it was my decision with our team yesterday to do two things with my power as the health officer. The first one was to make a recommendation. The first one was to make an order that built on a recommendation of last week. Last week, I recommended, as the health officer, I directed that we not have mass gatherings of greater than 250 people. Yesterday, I ordered no gatherings of 50 people or more. And any gatherings of 10 to 49 must use mitigation measures, social distancing measures, in order to occur. And an order is enforceable, is by law enforcement. Violations of an order can lead to imprisonment and or fine, and that's why I'm very appreciative of our sheriff being here in case there's any questions about that. The Association of Bay Area Health Officers have made clear that they believe this order is really of an educational nature. For example, someone does gather with 50 people and they would be told, move along. This isn't allowed. The health officer has ordered that this is not allowed. But I am going to be very closely working with my law enforcement partners to share the plan. So that's the order. The order is to ban any gatherings of a non-essential nature. It's so important that I repeat that. School is an essential nature. So if the school superintendents decided to have modified schooling, it doesn't come into this non-essential gatherings order, okay? So school is essential, and this order was regarding non-essential gatherings. The second part of what I did yesterday with my team was directed sheltering in place. It's a directive, it's a recommendation, so that's not an order. I can advise, I can recommend, I can order. So the middle choice, the directive for sheltering in place. What we did is County Council, we met late into the night, we crafted a directive, a recommendation that is nearly identical to what the Association of Bay Area Health Officers did, to what Sonoma has done, but it's a recommendation. And I will tell you that when we get our first case, it's going to become an order. And I can also tell you that I do not believe it will go more than several days before it becomes an order, because I'm very concerned about what I learned from my colleagues in the Association of Bay Area Health Officers. But we need some time in our county to prepare for what that would mean. We're a rural community. It's very different than the Bay Area. I'm going to share with you one of my concerns is that many of our people work in internet cafes and they require being in a cafe in order to do their work because they need the internet. They may not have that in the rural property where they live. So we have some nuances in our rural community regarding what is essential. So the shelter in place is for the shelter in place order of the Bay Area says that you can leave your house. You may leave your house for essential activities like work, like shopping, like getting health care. You may leave your house for those activities. But for all non-essential movement should be ceased immediately. So in our rural county, what does it mean if somebody requires for their job to go to an internet cafe? That is an essential activity because they need that for their living. So we have some time, a few days, to figure out what this will mean in our county. And I guarantee you, I give you my pledge, I will continue to share with you with transparency based in science and facts, and I will continue to work hard, as we are all, here at the county for the public's health to do our upstream preventive measures for the benefit of the public. And I would like to ask Carmel Angelo if there's anything that I missed. She's giving me this. It's a good sign. So therefore, I would like to ask my colleagues who are standing behind me to say a few words. We in public health rely on our physician colleagues every day. They're on the front lines doing the hard work for our community. So I'd like to ask them to come up one by one and say a few words. Introduce yourselves, please. And then we'll have time for questions. Thank you.
My name is George Verastegui. I am here as an interpreter for the Latino community, so I am going to read this press release in Spanish. La oficial de salud del Departamento de Salud Pública del Condado de Mendocino ha determinado las siguientes medidas. El Departamento de Salud Pública del Condado de Mendocino ha estado activamente respondiendo a la amenaza del COVID-19 desde el inicio del mes de enero del 2020. El 4 de marzo del 2020, las autoridades sanitarias del condado declararon emergencia sanitaria a nivel local. En este momento no hay evidencia de transmisión comunitaria en nuestra localidad. Sin embargo, debido al desabastecimiento de pruebas diagnósticas y al incremento del número de casos en el área de la Bahía de San Francisco, con una extensiva transmisión comunitaria, reconocemos la inminente amenaza que esto representa para nuestro condado. Por lo tanto, se ordena que debido a la rápida evolución de esta pandemia y en consonancia con las recomendaciones dadas por el CDC el día 15 de marzo del 2020, la doctora Noemí Duhan ordena la prohibición de reuniones de personas, de más de 50 personas por servicios no esenciales. Para reuniones de entre 10 y 49 personas se tendrán que tomar medidas preventivas contra el COVID-19. Como distanciamiento social, debe haber una distancia de más o menos de 6 pies o de 2 metros entre una persona y otra. Violación de esta medida será considerada una falta que será castigada con una multa o una prisión, o ambas. La oficial de salud recomienda, esta es una recomendación, que debido a que estamos monitoreando muy de cerca esta pandemia, se recomienda quedarse en casa. Esta medida ya ha sido establecida en el área de la Bahía en un esfuerzo coordinado de 6 condados, el área de San Francisco, Marín, el área de Marín, Santa Clara, San Mateo, Contra Costa y Alameda. Este esfuerzo coordinado puede ser visto en una página web que vamos a acercar a los medios de prensa. Asimismo, se restringe todas las actividades consideradas no esenciales, como salir fuera de casa y limitar al máximo ciertos negocios, tal como se está viendo en San Mateo. Este link también lo vamos a proporcionar a los medios de prensa para que nuestra comunidad pueda acceder. En este momento, la oficial de salud establece la recomendación que, en consonancia con lo que está pasando en el área de la Bahía, ordena quedarse en casa. Los residentes del condado de Mendocino que tienen planes no esenciales de viajar al área de la Bahía, se les recomienda cancelarlos. Gracias. Thank you.
Yes, hi. I'm Don Kersey, and I've been in the community almost 50 years. I was educated at USC Medical School and then served in Vietnam as a general medical officer in '69. Went on to Stanford for 4 years and got an ear, nose, and throat residency and practiced here in town almost 40 years. I really appreciate Dr. Duhan and what a great job she is doing, that she reached out and got some of the physicians locally here to help us make the hard decisions, and these are hard decisions. I think that she is making them on the basis of fact and science, which is very important. And she is the one in charge of taking care of the most vulnerable people in our county, and I'm talking about those in the nursing homes, the people who are in the jails, the people who are homeless, and thinking about them. And these people are the people sometimes that are overlooked. And she takes those people into consideration with each of her decisions. I don't have much else more to say, except I appreciate what she said today. She does an excellent job, and I hope together that we'll be through this soon. And on a lighter note, and because Dr. Flaherty is here, happy St. Patrick's Day.
Thank you, Don. My name is Jim Flaherty. I'm a resident of the county for about 15 years, and I recently retired from Consolidated Tribal Health Project as a pediatrician. I, at one time, was boarded also in pediatric emergency medicine and practiced general rural emergency medicine for several decades. I no longer do that, but I've been involved in a lot of emergency response planning and implementation with the Indian Health Service, where I spent my career. And so I have been asked by Dr. Duhan to come and join the team, and I'm here to do that. And one of the things I've noticed during the time that I've been following the pandemic closely, which has been for about the last 5 weeks, is there's a tremendous amount of information out there. And some of it is fear-generated, and some of it is scientifically presented. Find a source that you can look at every day and become familiar with the source. The Mendocino County's coronavirus COVID, it's at the top of the page if you go to mendocinocounty.org, and read each day's situation change and any press releases so you get an understanding of what's going on. It's very important for members of the community to be patient with each other, with the healthcare system, even though people are afraid of getting this disease and the impact it'll have on the most vulnerable population. And thank you for letting me help.
I'm Theron Chan. I'm a doctor of family practice. I've been here 41 years, serving many generations of our community. I am totally in support of the orders and directives from our public health officer, Dr. Mimi Duhan. It is crucial now for us to stop the spread of this virus. And there are two reasons for that. From the data we have, I think the catching it in this county, the risk is still low. And if you catch it, you'll probably get over it without much problem. But we have a population of elderly people with coexisting medical condition. If they catch it, it can be very serious. They get very sick. Some of them end up in a hospital. Some end up on a ventilator for respiratory distress syndrome, and many will die. So we owe that population some consideration to stop the spread. And these are the populations: your parents, your grandparents, your elderly neighbors. The other reason is, this has a pretty tremendous economic impact so far. Our patients, some of them lose their job, they don't have a paycheck, so we cannot allow this to last much longer. And the way to shorten it is to stop the spread of the virus. We don't have any treatment for it yet, but we have good weapon to stop it, and this is the social distancing, the personal hygiene, hand washing, stop gathering in big crowds, and these are very effective weapons. And these things did not come out of the blue sky. The Dr. Burke, who is a part of the coronavirus task force team, She is, a world-renowned epidemiologist, and she has talked to people in China, looked at the situation there. She talked to investigators in Korea and also in England, and they look at what worked all this time and what did not work. And so her plan of social distancing comes from pretty solid data, and it works. And so far, this is what we have, and I think that we should do it. I think that in retrospect, we may say that, there was an overkill. Well, so be it. But if in retrospect we realize there are things we could have done and what we should have done, and we never did, that would be very regrettable.
Hi, my name is Suzanne Hiramatsu. I am one of the emergency physicians that works at Ukiah Valley ER. I am thankful to Mimi for giving us an opportunity to voice our concerns. A lot of us are supported by the American College of Emergency Physicians. Our team, we staff much of Ukiah as well as Howard. We are avidly reading, staying on top of what has been happening in the other countries, how we can best prepare. We are here to make sure that we can continue to provide the essential services that the community needs, be able to take care of regular emergencies, but also prepare and protect the community if you need to come to the ER from contracting coronavirus and evaluating you and taking care of you if you become sick. So we are happy to be part of this, and we definitely support the her advice to shelter in place. It's going to protect as many people as possible, prevent any spread, and we are happy to see you, evaluate you, and help provide any answers, questions when you do come to the ER. That's it. Thank you.
I'm Drew Colfax. I first moved to the county about 47 years ago. I have a medical degree from Harvard and a law degree from the University of Michigan. I'm practicing as an emergency physician for about 15 years. I and my colleagues fully support the actions of Dr. Duhan, both the ones that she's announced today and over the last several weeks. As she stated, this is an evolving situation. I'm certain that she's going to have more directives and orders over the coming days and weeks. I do want to further emphasize what Dr. Chan said, which is if you are going to shelter in place, do so not just for yourself, but for your community members and your family members. Young people do not get quite as sick on average as the elderly do from this illness, but it's imperative that the young people do not spread this disease by ignoring the directive to shelter in place. Secondly, we are obviously happy to see anybody in the emergency room at any time, but I would urge people to at least contact their primary provider or clinic to discuss coming to the ER before doing so. We don't necessarily need to see everybody with a cough and a fever as this pandemic moves through this county. We want to see anybody who's having difficulty breathing or starts to become acutely ill. Local clinics and providers are working right now to set up telemedicine. The rules and the regulations on that have just been relaxed this morning, and that's going to allow much easier video conferencing with people at home so they don't get exposed to this illness in the ER. We are obviously working very hard to minimize the risk of exposure when you do come to the ER, but that risk can only be minimized. It cannot be eliminated.
Hello, my name is Besant Parker. I am the Chief Medical Officer for Adventist Health, Ukiah Valley, and Howard Memorial Hospital. I am thankful to Mimi and the county officials for the support that we are getting in this challenging time. It is very important that we listen to the directives that public health is giving. We as Adventist Health in Ukiah Valley and Willits are here to support and to care for you. You heard from some of our physicians. They are very well trained and prepared to take care of infectious diseases. However, this is a pandemic, and so we need the public to work with us to be able to be ahead of this pandemic. What that means is all that Mimi has said: social distancing. As some of our physicians have said, if you have a fever and a cough that is of concern to you, call your primary care provider, call your pediatrician, call your physicians, have a discussion with them to see whether or not you need to come in. And if you need to come in, we are ready for you. We are doing assessments and tests in vehicles in the parking lot if need be, in our clinics, in our EDs. We've set up a tent outside, and as earlier alluded to, very soon we will have video capability to take care of video visits. And so all that is going to be helpful in keeping patients from coming into hospital unless they need to come to hospital. We are part of a bigger organization, Adventist Health, 22 hospitals across the West Coast, and so we have capability to tap into resources at the system level. I do not think that you should have any concerns about our capacity to take care of you. However, countrywide, as you have seen, we do not want to overwhelm our health system, and so getting ahead of this curve is very important. With that, I will pause and hand it back to Mimi.
I want to thank my colleagues. You know, when I've stood up here before you recently, I've said that our highest risk populations include our healthcare workers, our elderly, and our healthcare workers. And we need to protect our healthcare workers, and that's one of the themes with this idea of call ahead. You know, don't go in if you can stay home. You're not sick enough to go in. Don't go in to ask for a COVID-19 test when you're really mildly ill and you can stay home. So it's to protect our healthcare workers and our healthcare workforce that we need to always be thinking about what we're doing. So are there any questions? I'm sure there are. Yes, ma'am.
I have a question from the community. What is your recommendation for county employees who are seniors? Should they come to work or stay home?
Carmel Angelo, Mendocino County CEO. You're asking for the recommendation, I'm sure, from Dr. Doohan. I can tell you that as the CEO of this county, we are doing everything we can to not only follow Dr. Doohan's directives and orders, but also to set an example. So at this point in time, we have new policies that we've written over the week to speak to catastrophic leave if needed, to speak to COVID-19, and also work from home policies. So we are looking at essential versus non-essential services. And I think I may have said this earlier, that's something we've done since 2017 with every event that we've had over the last 4 years. We have some departments that will close to the public, some departments that may close completely, and some of our other services may also either reduce their hours or be closed. all of our 24/7 emergency services, whether it's public safety or whether it's child welfare or adult protective services, those services will stay in place. The meeting that we'll be having on Friday, this Friday at 9 a.m. with the Board of Supervisors, we will talk more about essential versus non-essential services. Final comment is that we are following our health officer and either the direction or the order that she gives, and any order she gives over the next few days, we will follow as well. I'd also like to say that Dr. Dewan will be doing another press conference Thursday. I'm not sure of the time. Is it noon? 4 o'clock. Thursday at 4 p.m. will be another press conference this week that we will have with Dr. Dewan. Did I answer your question? Thank you.
First question is, after we ask these questions, can we have the George interpreter do a Spanish?
We do have a plan for making sure that our Spanish speakers get.
We're going to have them translated and on our website. Yeah. So we're asking George to stay with us and translate the questions and the answers, and we would put them on our website. Good? Yeah.
What are considered non-essential businesses that should be closing?
Yeah. Well, this is one of benefits of us having a little more time, so that I have county council here with me. This is a recommendation about sheltering in place for and only leaving for essential services. So we are going to be fine-tuning that, but certainly if you have a work that requires you to go to work, then that's an essential activity. If you have to go to the hospital, or if you need to go to the pharmacy to pick up medicine, to a veterinarian to take your pet to the veterinarian, these are all essential. The non-essential activities, we're just really trying to encourage people to shelter in place and stay at home as much as possible. So they're in the directive, it actually, you can read a lot of detail about the definition of essential and non-essential, and it's on the website. Okay? Yeah?
I have a question about the screenings. We all had our temperatures taken when we came in here, and I'm wondering at what point would the screenings trigger what kind of action? Turned away or
Right.
tests? What are the screenings for?
Well, when you came in, that's a great question. I mean, if someone came up to the door and they had a fever and a cough, we would ask them to not come in. And we would ask them to stand 6 feet away. And, they would ask them to call their medical provider to get advice. I mean, we do rely on people knowing when they need to seek medical advice or not. And with influenza, for example, which is going through our community right now, and people can get tested for it, and then they can find out they have it, many people go home and take some Tylenol and rest and drink tea and get better. So we are relying on our public to know when they need medical advice, and we are wanting to discourage anyone who has a fever or a cough from coming into a group setting, so that they avoid infecting other people.
So Mimi, repeat the question when they ask you.
Oh, I'm
because they're
sorry.
not hearing online, they're not hearing.
The question was, what was the purpose of taking our temperature when we came into the room? The first question was, what are non-essential and essential activities that would lead someone to stay home?
I have another question. We've heard a lot of anecdotal stuff about equipment like masks and swabs and things being stolen.
I'm not aware of any masks. Sorry. Thank you for reminding me. The question was, it'll take me a little while to learn this. The question was that there's been news of people stealing masks and other, what we call in the medical profession, we call it personal protective equipment, or PPE, and that there's been rumors or reports of people stealing masks and gloves, I guess it would be gowns, and I'm not aware of any episodes. I'm looking at Jen Banks here, who represents our emergency medical services. I'm looking at my clinician colleagues. I'm not seeing anyone. I myself, we do have personal protective equipment at the county. We're not aware of anybody stealing, hoarding personal protective equipment. What I can tell you about is there are severe national shortages of this equipment, and this is one of the strains that's being put on our healthcare providers as they're being asked to modify what would be their standard protocols around using personal protective equipment in order to continue to provide care in the setting of shortages of that equipment. It's putting a great deal of strain on our clinicians, and one of the services that the county provides is that we have what we call surge capacity, or we have resources that providers can request additional masks and respirators and so on from our county, and we work very, very hard to meet that demand. But no, we haven't heard of any reports of stealing or looting. Yeah. Yeah.
There's been discussion at the state level about a suspension of evictions during this pandemic, and I know the court might be closing. So could you speak to that or make comments with that?
Well, we do not have a shelter-in-place order at this time. It's a recommendation. So at this time, that wouldn't be addressed, I don't believe, in our recommendation. But I did see in the Bay Area Health Officers' unified statement, which you can find on our link to our press release from yesterday, that there was a suspension of evictions, as I recall, in that shelter-in-place order. So these are the types of complexities why we worked late into the night with our attorneys, that we really, when you do order something, when the health officer orders anything, we have to consider all of the legal implications, but certainly something like shelter in place. This has serious legal implications, but I do believe that the Bay Area included a cessation of evictions.
Just repeat that question.
The question was, I'm really not learning this. Continue to remind me. The question was, what is the impact on evictions of this shelter-in-place recommendation, which could convert to an order?
Do you have any estimates on what is your current testing capacity and how quickly is that ramping up? And if you could also speak to drive-through testing.
Those are some great questions. Thank you very much. The question is, come with me. It must be those 16-hour days, I'm telling you. The question was, you guys, what about drive-through testing? What about our testing capacity? What was the third part?
How quickly is the testing ramping up?
Testing ramping up.
Current capacity and how's it ramping up?
Well, those are some really controversial issues that you're hitting on. The question about testing ramping up, I don't think there's another doctor in this room. I think all the doctors in this room would agree to me that there's a crisis around testing at a national level. There's shortages of not only the viral transport medium that you have to put swabs in, there's the shortage of the swabs, there's shortage at we send them off to labs. Those labs have backup and can't process the samples. I mean, it's pretty much, challenges at every single level of the chain of processing these samples. I'm very happy to announce, and I don't know if we have the box here in the room, but we have been advocating for weeks to have the public health lab in Sonoma receive testing capacity that can allow us to do 50 public health labs this week. And we're so delighted that we received 50 test sampling kits, which is a swab and a tube with viral transport medium in them. And therefore, we can do 50 tests that we are wanting to do in this next week. If we find people who are having symptoms, we're going to be targeting our outreach to our populations experiencing homelessness, and our populations in the county that are frail elderly living in congregate settings like skilled nursing facilities, and also our incarcerated people in the jail. And so what we're wanting to do is 50 tests in the next week for people that are at high risk of having serious impact from this disease, as well as risk of spreading the disease because they're in a congregate setting. The Public Health Department in Sonoma County the lab, the samples are collected here by our healthcare partners. We, the health department, participates in the transport of those samples to Santa Rosa to the lab, and their turnaround time is 24 to 48 hours to give us a result. That's the public health department today. We have these 50 sample kits. I can't tell you when these are used and sent off, how many there'll be after that. We have shortages, so we're really working with our partners to make sure that those people who need to have tests because they're very high risk of having the disease will be tested. But it's a triage, so we're starting with people at high risk of having the disease, who are high risk of being ill, and are high risk of transmitting, seriously ill and high risk of transmitting the disease. Yeah, any, in the room, any other questions?
In one press release, we read that one of the recommendations is for the person who didn't get the flu vaccine to do it, to get one. And I received a comment from my readers that they are scheduling appointments, but there are appointments until April or May. So the county is taking action about this?
I don't, about flu shots, is the county giving flu shots because people aren't able? I know that the county we have gone out and really pushed out our flu vaccines, but I don't know the status.
We'll find out.
We will give you an answer to that on our website. Thankfully, we are winding down into our influenza season, so, yeah.
Given the order to shelter in place in the Bay Area, can you speak to travel between the Bay Area and Mendocino County if there are any restrictions?
There's no restrictions on travel, but I did explicitly state in the press release that I would recommend and advise people not travel to the Bay Area if you can avoid it, if it's non-essential travel. I think that would be very risky. We all are aware that we have young people whose schools have been closed from all over coming here today, yesterday, now, and they're going to be bringing it with them. I'm sure some of them will. So we can't restrict them to come home. Those are college students. Oh, the question was, I'm just really not getting this. The question was, what about travel to the Bay Area? The question before was about access to the flu shot, and this question was about restricting travel to the Bay Area. So I'm saying we're not restricting travel, but we're recommending against people traveling from here to the Bay Area. We cannot restrict people coming home to Mendocino County or getting out of college. Yeah. Yeah.
There's a couple questions about the seniors getting possibly, an hour be reserved at stores for them, or that meals be brought to them. Do you have any guidance around what would be the best solution for them?
So one of the things that we really want to do, the question, gosh, I just can't, keep reminding me. See, that's why I'm keeping Dr. Flaherty right next to me. I just cannot remember this part. The question was about how do we protect our seniors, and what about having certain hours in the stores where they can shop because they are at higher risk of getting serious complications of the disease. I think this is where we're going to see from the Bay Area, that we're a couple days behind them in terms of them implementing the order, that we'll see some of the creative ways that communities come together to solve problems, to protect our people. This is a time, and I think you heard it from my colleagues a moment ago, this is a time where we need to really be selfless, we need to be creative so that we protect our whole community. And that might be saying, okay, the first 2 hours of any store that's open, we're going to allow the seniors to come in so they can be 6 feet apart so they don't feel rushed. Regarding the second part of your question was about getting food. Right. So one of the things that we would like to do with our church community, I'll say this as a call about how we might provide meals. The question was about how we might provide meals to our seniors who might be homebound, is I would like to make a call a gathering of our faith-based communities to see how we might work together for our faith-based communities to help us come up with solutions for our seniors. We also do have Plowshares, which does Meals on Wheels. So we in the Public Health Department are looking at ways that we can do that work of public health to make sure that people get food, and not just food, but we need to make sure that people don't feel despair, that they don't feel lonely, that we find ways to reach out to one another, like the Italians who are singing from their balconies. We need to do that. That's part of our health. Yes, we're thinking about the seniors. Thank you for the question.
Another question on top
Yeah.
of that for seniors, the tele-video with doctors, they had talked about that even up at the White House. Will there be a support team in place for seniors that are not online savvy?
So the question,
I'm in the back and I can repeat the question
thank
for
you.
our listeners.
I rely on Sarah for everything.
So the question was about support for our seniors who don't have access to telemedicine.
Thank you, Sarah. And great question. That is a question for the clinics, but I would assume, I'm going to answer for them and they can tell me if it's different, that priority would be given to seniors or any person who doesn't have access to internet to come in and be seen in person. I'm sure that that's what they're doing, because this is always, access is always a principle of primary care. So these are the things that it's very helpful that we have some time, a few days, some time to adjust to this new reality that we're in, which is very, very difficult of sheltering in place. Sheriff, do you have any words you might want to say, given that this is an order about about gatherings of people? Hey, I'm just looking to you. I thought maybe you might want to come up. We work very closely together, Sheriff Kendall and me.
Except for right now, when we stay 6 feet apart. So we work closely together from a distance nowadays. So I prepared just a little bit of a statement because I was able to speak with the chiefs of police this morning on the telephone. I was also able to speak with the chief of the Round Valley Indian Tribal Police yesterday afternoon. So basically, one of the points that we've been trying to drive home today, and I think everybody needs to understand it, as a society, one of the things that we're truly judged on is how we treat some of our most vulnerable members. And right now, our most vulnerable members in this are our elderly. Anyway, I prepared just a really short statement and made it in really big letters so I can see it. But the Mendocino County Sheriff's Office, as well as the chiefs of police, we had a discussion regarding the health officer's orders this morning. And as discussed, the current order, although it's just a ban on certain mass gatherings and social distancing restrictions on the smaller ones, it's still an order. In that press release, it talked about enforcement, and I just wanted to discuss what that enforcement would look like. Okay, oftentimes enforcement is nothing more than education, because truly in my business, education often turns out to be prevention, and if we can prevent the spread of this, that's where we need to be. Mendocino County has been through a lot of problems in the last 3 years with a lot of disasters and various other things, and we have come together and really done a good job, because we're very resilient people and we're constantly helping each other out and doing the right thing. Currently, I'm asking for all of the residents to assist us to support Dr. Doohan and to support 100% of our medical community, support the law enforcement officers, the EMS personnel, and support each other by please heed the warnings and let's not violate this order. If the sheriff's office or any police agency is called to a large gathering, we're going to start with education, and we're going to ask them to please disperse and talk about the dangers of it. And we just want everyone to understand that we're trying to keep our people safe so that we can continue to serve. Does anybody have any questions for me?
Specific to the sheriff's office and other police agencies, can you, I know you sent a press release last night, but can you just briefly speak on changes to patrols, changes to call procedures, and if there will be any changes, for instance, with domestic violence calls?
Okay. So the changes in patrols, strangely enough, with a lot of the training and whatnot that would normally go on this time of year being canceled across the state, we are actually having a really good surge of extra personnel in our ranks right now because we aren't sending those people out to training. And so the changes in patrols, you'll see a lot more deputies on the street. It's not that we have put a lot more people on overtime or anything. It's simply we have more available deputies. With the changes in calls for service, if we have a call that a deputy does not need to show up and take evidentiary items, then that deputy is most likely going to handle that call over the telephone. This is not going to change emergency responses to crimes of violence, domestic violence, anything like that. We're going to handle that just in the exact same fashion that we had previously. We are going to do a little inquiring as to whether or not people are ill, and things like that, so that we can make sure that we wear the proper personal protective equipment.
The question was to talk about visits to the jails.
So currently, a lot of the programs that we've had going on in the jail that were contact programs, such as a lot of religious programs that are being instructed by members of the clergy, those have gone to non-contact. They're going to the visiting areas where they have the phone that they can speak through. The visitation will continue kind of in the same fashion of non-contact, but we're shutting down some of those programs that are contact or moving them into non-contact setting. Any online training dealing with corrections to college and things like that, we're working to make sure that we can get the instructors Skyped in, and the guys who are taking that training, the guys and gals that are taking that training, will still be able to take that training via the internet. Nothing else? Thank you.
So I think we're gonna have to wind down our time because we have a lot of work to get to. But I want to make a comment about testing. In Wuhan, China, when this epidemic first broke out, there was a point in time where they really started focusing more on other clinical ways to evaluate people with CT scans. And they stopped relying so much on testing and shifted over to a different way to evaluate patients. And I just want to reassure people that even if we have shortages of tests, our clinicians have other ways to evaluate people to determine whether they should be in isolation or whether they might have other complicating presentations that might lead them to be prioritized for testing. So just know that even if we are in a setting of shortages of tests, we can still determine who should be isolated so we don't spread the disease. Should we be winding? I'm just lost track of the time. I know we keep going a little bit longer.
We'll
Okay.
take 2 more questions.
2 more questions. Okay, go ahead.
Quick question, medical question. I'm getting this
Yeah.
from several people in the audience. A couple few medical questions. One is, should elderly people be getting the pneumonia vaccine? And is this virus something that you can catch twice? If you get it, what's the range of symptoms and how long would that last?
Yeah, so the question was, should seniors get the pneumonia vaccine? I would definitely recommend that people stay up to date on their vaccines, especially those that are respiratory at this time. Like, we were definitely recommending the flu during flu season, pneumonia vaccine as well. There's still emerging information from this pandemic, and I have not seen any solid evidence that people can get it twice. I think one of the reassuring pieces of data around that is that in Wuhan, China, we're seeing the number of cases going down and the number of deaths going down. And I know there's a lot of questions about the nature of how the disease presents, and I think that would be a good thing for us to put on our website, Sarah.
Can do that. We actually have quite a few questions that have come in from churches wanting to know a little bit more or guidance on whether church services are essential services.
Yes, so I think it would be a really excellent idea if we could schedule a meeting with our church leaders to determine what is essential in the faith-based community for the gatherings and what is not. But what I recall from the Bay Area order, which we are following in at least as a recommendation at this time, and is in the same language that we drafted yesterday, is that church is a non-essential activity, but we are certain that there are essential activities that are included in church, and we would like to support our church partners in those essential activities. And that can also include things like helping with meals and helping with staying connected. So I would like to call for a meeting with our faith-based leaders in the coming week. And I think that's it for questions. Yeah.
I'm sorry, I just want to say that we actually have county staff scheduling a phone conference with the churches rather than an in-person meeting. And also, Dr. Parker wanted to make a comment about the hospital before we end.
Just a quick one. Wanted to let you all know that we've moved to a no visitor policy except for our OB patients and end-of-life cases and any special cases. Also, because we are restricting visitors, we are trying to keep just few entrances open. So we have our ED entrance open and we have our OB obstetrics entrance open. Within the hospital, we are limiting meetings to very few people and doing a lot virtually. Thank you.
And as we end, just a reminder that we have another press conference scheduled for this Thursday at 4 p.m. with Dr. Doohan. And then also this Friday, March 20th at 9 a.m., we have a special board meeting scheduled. That board meeting will be virtual, but this will be the center for that board meeting. Thank you, everyone.